The last time I was in, not last time, some time ago I was in a conference, in a CII conference, and there the person who introduced me, I was Chief Operating Officer at that time, and he introduced me as CEO. Since then I became Deputy CEO, but Shashank, thank you for the elevation to Chairman. Maybe it's a sign of things to come, but thank you for that introduction. Before I start my presentation, I thought I'd preface this with, I spent some time over lunch with some of you, and clearly the Indian healthcare industry has big problems to solve. I'm sure all of you in this room know this, but it is still the single largest reason why our countrymen become poor. The financial stress on account of unexpected healthcare events is the single largest reason why our countrymen still fall poor. And it is a shame that in this time and age when we are talking about digital India, we're talking about Make in India, we are still suffering from vector-borne diseases. All of you who live in many parts of our country, certainly Delhi NCR, we have seen a terrible outbreak of vector-borne disease this year, and it happens every year, and it's a problem that we've not been able to solve. That aside, one of the problems that particularly concerns us as a health insurance company is the gaps, and really that's the topic of my presentation, is the gaps that are there between us as health insurance companies and providers, and together we are a very important part of the ecosystem that delivers care to customers. So with that, let me start with my presentation, and really I have a simple agenda. What I'd like to do, based on our experience and my experience working with providers from the health insurance side for 15 plus years, is to highlight what I believe are some of the important gaps, very germane to the environment we operate in India today, and what do I believe are some of the solutions that can go towards bridging that gap. And forums such as these, Shashank, I believe are an important step in bridging the gaps that we have in our industry today. The first gap is what I would call gaps on account of information, imperfect information. I'm sure all of you know the word information asymmetry, but this is one of the big gaps that bedevils health insurers and healthcare providers. And it really starts with the gap that is between the consumer and the provider. Because when you think about it, because of the expertise nature of rendering healthcare services, the provider determines what is wrong with the patient. He determines what is the line of treatment, and he also, to a large extent, determines how much is that treatment going to cost. And the balance of information and knowledge is on the provider side, because today, in spite of Google, in spite of access to healthcare information, the balance of this information is with the provider, and therefore there is information asymmetry. Now, this feeds into insurance companies in several ways. One is, it raises questions of what is medically necessary. It raises questions of what's the right treatment protocol. And fundamentally, it raises the question, or it leads to what we would call a coverage decision. So that's the first variety of information gaps that we deal with vis-a-vis providers. The second is quality. And when you think about quality, there's quality. When you think about quality in the healthcare system, there's quality with respect to infrastructure. And today, I think we are all in a position to assess that. There is quality with respect to process. So your accreditations, whether NABH, NABL, or JCI, that's a marker for quality. But the holy grail is what is quality when it comes to outcome, and there's no easy answer. And even today, when somebody asks the question, who's a good doctor? Perhaps the best way is to ask some other doctor, and this is something that we often encounter in Apollo Munich, and we get deluged with so many questions around, hey, who's a good doctor for this particular condition? Where do I take my child to? And there's no good answer to that question in our country or indeed in anywhere, in any part of the world. But I think that's an important gap because fundamentally what we want to do as healthcare, as health insurers, is to send our patients to the best quality providers adjusted for price. So, quality at any cost is not the answer that we're looking for, but quality adjusted for price is what we're looking for, and that is a gap between us today in our country and anywhere else in the world is what I would argue. And lastly, in a forum like this, some time ago, somebody made a comment that it's acceptable for consumers and for indeed us who work in insurance companies that prices are differential when you go to a hotel room. Depending, you're okay with the airline company charging you a larger price based on when you travel, etc., etc. So why is it such a big deal that hospitals have different prices? And my response to that is based on 2-3 factors. One, in most countries, and in our country as well, healthcare, we believe, is a right, not a privilege. Right? More and more countries, and certainly in India, we are moving towards enshrining rights. So, for example, all Indians have a right to education. I don't know whether right to healthcare is still there, but I think the thinking from government is, especially some of the recent thinking, is that healthcare should be universally available. Quality healthcare should be universally available. So that's one consideration that negates that we need to bring to bear as far as pricing is concerned. Second is healthcare is a public good. Citizens of the country having good health benefits society at large. It is a public good. Therefore, for all of these reasons, I think this question of pricing is very important when it comes to the healthcare industry and to the health insurance industry. I mean, just to give you an example, and I'm sure you already know, if we had to sell a product for 10 rupees to a consumer, we need to get the regulator's permission. So that's the kind of consumer protection that the health insurance industry is under. And I think that's very important to how we interact as industries. The second big gap that I want to speak to is what I would refer to as misaligned incentives. Fundamentally, our business models, there are different objectives. Our business model, quote unquote, is premised on keeping people healthy. While healthcare providers don't want, while none of us wants people to be sick, but the provider model is built on treating sick people. So keeping that aside, which is a fundamental business imperative and business objective conflict, I think fundamentally there is a misaligned incentive in terms of how the payment system works. Today, in our country and in the most sophisticated market of the world, the payment system works on a fee-for-service basis, which is, simply put, the more you treat somebody, the more you get compensated. And that's a fundamental incentive misalignment between insurers and healthcare providers. There is no easy answer, there's no easy way to solve for it. But in my next section, I think there are some interesting pilots, interesting experiments that are going on in terms of how these incentives can be better aligned. And lastly, and this I think is the one that we can, relatively speaking, easily solve, is today in the healthcare ecosystem, there is enormous friction in terms of the consumer experience. There is friction within the provider's setup. Each of us has been a consumer in the healthcare space, and the experience lacks reliability, is not consistent, and we were having this conversation over lunch, and it is acceptable to have 2, 3, 4-hour wait times. That's a terrible experience from a consumer standpoint. And what makes this worse is when it comes to inpatient situations, the handshake between providers and insurance companies is terrible. There is a lot of, in spite of the fact that some government schemes have put technology in place, by and large, the private sector, health insurance industry, and the healthcare industry talks using paper, talks using facts. There's lack of standardization that's preventing us from using technology in a more seamless fashion. But this is a source of enormous friction between these two industries and a very big gap as far as serving the end consumer, which is common to both of us, is concerned. How do we solve this? And really, solving it is a long journey, not easily done in a limited period of time, but I think there are three broad solutions that we can focus on. Now, in any industry, if you look at it, whether it's telecom or airlines or television, there is some fundamental plumbing that goes into the building of the industry. For the industry to grow and thrive, some plumbing has to be in place. And in my view, as far as the healthcare industry is concerned, and as far as your interaction with us is concerned, there are two kinds of plumbing that I think are important to be in place. One is what I would call standards, and the second is there is a whole suite of technology plumbing that needs to be in place if our industry has to really grow and thrive and provide that great customer experience that all of us want. So what I want to do on this slide is to focus on standards with respect to the practice of medicine. The first one is something that probably all of you are familiar with. It is prevalent in many other markets. It is something that has been under discussion in India for a long time now. For example, there are treatment protocols that have been developed by Vicky, my colleague here, has been involved. Those have been developed in consultation with several experts from the medical fraternity. There's been protocols that have been developed by AIMS, and there's a bunch of protocols that have been approved by, I understand, the Ministry of Health. But in terms of the practice of these, I think if these were practiced with a larger set of providers, it would help the dialogue between insurance companies and providers, and also help from a consumer standpoint, because then this whole issue of information asymmetry comes down. On quality, I think there's a lot that can be done on process quality. Today, the percentage of providers who are accredited, whether NABL, NABH, or JCI, in our country is abysmally low. I think this is an important marker for consumers. It's an important signal to all stakeholders involved in the system that, hey, we have a certain set of standards that we adhere to. Outcome quality, I don't even want to touch upon it, but once we did this in place, and more importantly, once we started making this available, today I think even those who adhere to these standards, that information, for example, is not available to us as insurance companies. So even if we had to factor in quality in our payment decisions, if we had to factor in quality in how we reimburse providers, that information is not available to us. So I think not just putting quality systems in place, but more importantly, publishing these, making them available to all interested stakeholders, I think is an important step that needs to be taken. Outcome quality I touched upon. Really this is where we want to move to, because process quality can only take you so far, but ultimately what we are interested in is, hey, did the doctor diagnose the condition on balance correctly? And did he treat the patient in a way that promoted some outcome, right? The outcome could be good health, it could be survival, it could be longevity, but we do need to start thinking about this, and some thoughts have started in some markets in the world that I'm aware of. But I think unless we start putting some of these thoughts in place, we'll never get to start looking at what truly matters from our end customer standpoint. And lastly, there is one is with some providers there is some level of price transparency, but here really the point I want to make is today for most consumers who enter into, let's say, inpatient hospitalization situations, with a large number of providers, it is not clear to them how much is that going to cost, right? It is not clear to us as insurance companies, and this is a source of a lot of handshake. And if you ask me, a lot of unnecessary handshake between providers and us in terms of what is going to be the cost of a particular treatment. So I think this price transparency has a very important signaling role to play in our country, and this could help bridge the gaps that I spoke about. Now, if I had to pick one thing to address all of the gaps that I spoke about, I would pick this one. Because fundamentally, this is at the heart, in my view, of a lot of what goes wrong in the handshake between you and us. We've got to find a better way, we've got to collectively find a better way to pay for what I would call performance. And there are some interesting experiments that are going on in the United States most recently, especially after Obamacare got started. And a lot of this is to, I wouldn't say shift, but to bring about greater accountability between these two industries with respect to outcomes for patients. So greater there are what you would call accountable care organizations that are in existence. There are pilots around that. There are capitation payment arrangements where the incentive for over-treatment, unnecessary treatment is removed from the provider side. And there are also bundled payments where you're not just looking at points of care in the large spectrum, but you're looking at the entire episode of the customer journey when he goes through care. So somebody who's diabetic, the set of required providers come together, and there is, you look ahead in terms of what is the continuum of care as far as the diabetic is concerned, and the payment system is aligned around that. So this is probably a much better way to, as a reimbursement mechanism between insurers and providers, because then you get away from this whole issue of over-treatment, unnecessary treatment, etc. So again, to emphasize, if there is one thing that I would pick to close the gap between payers and providers, it would be on figuring out a better payment mechanism between us. And lastly, and very important, especially in the Indian context, and really this conference in some ways is a platform of bringing us all together through technology. Today in our country, while there is talk of standards, there are limited standards in terms of data capture. While there is, quote unquote, the health ministry says that ICD-10 is the standard as far as hospitals are concerned. They're still discussing whether it's SNOMED CT or some other standard for all other situations. But there are no universally followed standards for data capture, and this is a huge issue, especially if we have to, all the patient data that the practitioner wants to collect. Ultimately, it has to stand on some bedrock of standards, and the data is fundamentally captured in the provider ecosystem. So that's one. Second is there are no standards for exchange. So the handshake, as I was referring, the handshake between the provider and the insurer, or indeed the handshake between the provider and any ecosystem participant today, there are no standards around that. So this is the second, plumbing that I referred to. If this industry has to grow and thrive, if this industry has to solve in a fundamental way the healthcare problems of our country, which are huge, I think this is a very important element that we have to get together on. This is a significant opportunity for a platform such as Practo to ease the enormous ecosystem friction that is there today in our industry. It helps our customer, and I think it helps all of us. So that's really what I wanted to say. Thank you, ladies and gentlemen. Thank you.